Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is Medicare Planning, Understanding and Optimizing Your Options, sponsored by Prince George's County Government and the Department of Family Services.
Hi everyone, Mark Gottlieb. Thanks very much for joining us today. Hopefully you'll find this to be very informative and help you in your planning efforts now that we have arrived at the Medicare Annual Enrollment Period. So just to give you a little bit of background of myself, which is on the next page of the presentation. I have many years of experience in both the health services and insurance industries. I have served as administrator of an 150-bed senior living community, so I know the healthcare business on that side of the fence, so to speak. I'm an independent broker, so I offer multiple products, and in this particular case, I'll be speaking about multiple products from Medicare, since that's the topic today. I am a HIP and AARP certified, so I offer all the AARP products as well as most of the others. And I do offer advice at no cost. I conduct a number of webinars about healthcare expenses in retirement, speak with a lot of people about their particular coverage and what their needs might be. I'm always happy to help educate the community in these issues. So with that, we can begin the presentation about Medicare today. Just as a brief overview, there are 4 parts of Medicare, and those are A, B, C, and D. Very easy, just like the alphabet. Parts A and B are offered by the government. Hopefully everyone on this television broadcast has A and B, or if you're going to be signing up for Medicare, you will possibly get A and B. B depends on whether or not you have other existing, what's called creditable coverage. Like if you're still working and getting coverage through your employer, you would not need to sign up for B. But in any case, Part A is pretty much focuses on hospital care. Also will provide for some short-term home care post-hospitalization, some short-term skilled nursing and rehab, and luckily Medicare does cover hospice as well for terminal illness. A is typically $0 in premium. If you've paid into Social Security, you or a spouse has paid in for 40 quarters. If you don't meet those qualifications, Part A can be purchased for a price, which I'll be getting into. Part B is really all of the outpatient things, outpatient services, outpatient centers, ambulatory care, doctor's offices, diagnostics, therapies, for instance, physical therapy, occupational therapy, speech therapy. So Part B, you pay a monthly or quarterly premium. You can pay through Social Security. Basically in the 145 at this point, it's actually 148 for new enrollees. Others would have paid less if they joined the program earlier on, but then their Part B premiums increase. There are increases, unfortunately, for all of us every year. They're modest, but they do happen. So over time, we do start paying more for Part B. Part C is also known as Medicare Advantage. So you'll see a lot of things on television and they're relating to Part C. And really, a lot of people don't even know what Part C is. So it's kind of synonymous with Medicare Advantage plans. So you know, that's something I'll be talking about today. And then, of course, Part D, hopefully anyone on Medicare has a Part D plan. Can be a standalone or with Medicare Advantage. If you combine prescription drug with Medicare Advantage, it's known as MAPD. So again, when you're receiving literature, looking at the television, hearing about all these MAPDs being offered. That means it's a Medicare Advantage with prescription drug built in. So you need to join a prescription drug plan within 63 days of signing up for Medicare, or you can face some penalties. Again, if you're, let's say, over 65, have employer insurance, and then when you leave the employer and sign up for Part D, there will be no penalties because, again, you had what's known as creditable prescription drug coverage. So that's a quick overview of Medicare. And we'll go on to the next slide. So there are a number of enrollment periods. Now, what makes this presentation extremely relevant right now, of course, is because we are on the second arrow down, the AEP, the Annual Enrollment Period. Some people call it the Open Enrollment Period, but technically speaking, it is not. It's the Annual Enrollment Period. October 15th, which started last Friday, through December 7th. So if you want to make any changes, you have to do it within that time frame. If you were to call any company or call myself and say, well, I've been thinking about it and this is the change I want to make, and it's now December 10th, you're going to be told it's too late. The period ended the end of the day on December 7th. During the annual enrollment period, you can make changes with your Medicare Advantage or your prescription drug coverage. It's a great time to shop around. Again, everyone right now may be a little overwhelmed and confused because we've all been bombarded with mailings, with TV ads, literature, flyers, phone calls. And so one has to be aware of, what it is people are trying to get you to respond to. But this is the time to do your homework or to talk with reputable agents. I'll put myself certainly in that category. Something important to know is really, because you're being bombarded, you're getting literature from a lot of different companies, and we get overwhelmed and we don't know, well, which company should I choose? How does this plan differ from the other? So it's important to have an understanding of all the different plans and what your choices are. Again, going back up, IEP, initial enrollment period, when you turn 65, you'll at least sign up for A. You may not need to sign up for B, again, if you have coverage through another source. Coming down below annual enrollment period is something called a true open enrollment period, starting in January, going through the end of March. So let's say you sign up for a Medicare Advantage plan during the annual enrollment period. It will take effect on January 1. Let's say you go to a few physician encounters, or you're trying to get services of a certain type. For one reason or another, you're not happy with the Medicare Advantage plan you chose. It's not all you thought it would be. Open enrollment period is a time you can either switch to another Medicare Advantage plan, or you can switch back out of Medicare Advantage, go back to having your Medicare Parts A and B. Then you want to apply for your Part D, prescription drug. You might have had that with the Medicare Advantage plan, so now you're going to have to add a freestanding Part D. The one thing I caution people about, when you do that, if you back out of a Medicare Advantage plan and you're beyond the first 6 months of having signed up for Part B, then you would be subject to something called underwriting. So you would not be guaranteed acceptance into a Medicare supplement plan, and then you would be caught short. So that is something you have to be careful about and concerned with. There are other periods called special enrollment periods. If you lose your employer coverage, you lose it, you leave it, then you can sign up anytime. You don't have to wait for the next annual enrollment period. So if I'm leaving my employer May 31, I want to make sure I have coverage for June 1. I'm in the special enrollment period. I can apply to whichever plans I'd like, and they will accept me in that vein. You might have lost existing coverage through a spouse. You may have lost coverage because of change of address. That's very common. You would enter a special enrollment period, be allowed to enter your new plan without waiting until the next annual enrollment or open enrollment period. Something called the general enrollment period as well. It's a little more complicated, but if you've missed some deadlines for applying, you might then have to wait to a general enrollment period. So it gets very confusing. And again, that's why it's good to be able to attend a session like this, to be able to give you an idea of all the components of the Medicare program. It's overwhelming in a short presentation, and these kinds of facts are being given to you to make you aware. You may not fully embrace them from this presentation. You'd need to do your own research or call me for more information to try and clarify your situation. So with that as the enrollment periods, we can move on. And what I've done is try to just give you a few pages about A and B. Again, this is a lot of information in a very short time frame. That's what makes the Medicare program so complicated. So again, Part A, 0 premium. There is a Part A deductible of $1,484. So if you go to the hospital and all you have is coverage is A and B, you're going to have to pay $1,484 deductible before the Part A coverage kicks in. After the $1,484, you'll be fully covered, but you will have the $1,484. Now, if you signed up for a Medicare supplement or a Medicare Advantage plan, you would not face the Part A deductible. One of the reasons why we need supplementary coverage. There is a Part B deductible of $203. If you bought a Medicare supplement plan and you go for your first office visit, diagnostic center visit, whatever the case may be, you show them your Medicare supplement card, they're still going to say you have to give us the first $203. Now, if you had joined what's called a Plan F, for those older than 65, before January 1, 2020, you could still buy a Plan F. For a Plan F, there would not be that $203 deductible. You'd be fully covered. So that's a great thing. Again, if you're now trying to apply for coverage, you're just turning 65, you would have something called a Plan G. I will talk about that in the Medicare supplement part of this presentation. And those premiums are actually a little less. So don't feel too badly about the fact you have a $203 deductible, but your premiums may be less expensive. People should be aware there's a wide array of preventative tests and screening through Medicare Part B. You should be aware of that. Your physician should as well. Main thing you should know, again, about Part B, or certainly one of the big issues, and they're constantly talking about this in all the ads and all the flyers, etc. Part B covers 80% of outpatient. You have to bear the brunt of the other 20%. Of course, if you have some kind of supplementary coverage, that may not be the case, but you'd like to have the 20% covered. Now, some people may say, all right, so I go to an occasional physician visit or, a therapy visit, and they charge me 20% of a bill. Let's say the bill is, $100. So 20%, I'm going to have to pay $20 of it. No big deal. Why do I want to pay all these premiums for supplementary coverage? The answer is because the 20% can add up to an extensive amount of money if a person is using a lot of medical care. So insurance is really to protect us against, some kind of serious condition, a chronic illness, a serious accident, and things of that nature where you're going to be using a lot of medical care. If you're one of the lucky people who hasn't had, a major diagnostic, a major issue, you don't possibly realize the importance of having that extra coverage. But once you need it is when you need it. There's something called the 3-day inpatient rule. Just be aware of that before you can be sent over to a skilled nursing or rehab facility. Post-hospital, you're supposed to be in the hospital for 3 days. Otherwise, the first 20 days of care in the skilled nursing or rehab facility may not be covered. Also, if you're kept for observation, for instance, you go into the emergency room, you're under observation, and it was not considered inpatient. They might have had you even in a bed overnight, but that is not considered a day of inpatient care. So when you're in observation, you really, the bill will be based on that Part B. We're back to that 80-20 rule. So again, you kept for observation, the bill's $5,000. You don't have supplementary coverage. 20% of $5,000 is $1,000. You will get a bill for $1,000. So we all need to be aware of this before it happens to us. So with that, I'll move on to the next slide. So again, Part A will pay for the first 20 days, assuming you had that 3-day inpatient stay. Medicare Part A would then pay for the first 20 days of care in inpatient rehab with skilled nursing. So if you've had a stroke, if you've had a hip replacement, etc., they send you to a rehab unit, make sure Medicare is going to cover it. And that'll be for the first 20 days. Some people are surprised when they get a bill and they find out they didn't have a 3-day inpatient stay or some kind of waiver for that care, in which case the first 20 days of care would not be covered. You'd be responsible for it. Assuming you do have the coverage, on day 21, you will start paying copays of $187.50 a day. So if you stay 30 days instead of 20 days, you would have 10 days in which you had to pay $187.50 a day for that care, unless you had some kind of a supplemental coverage plan. So again, this is all, these are important reasons that one should consider different supplementary coverage options. Part B enrollees, if you're just entering into the Medicare program, your Part B, again, A is going to be free. Part B is going to have a base premium of $148.50. That'll probably raise for the start of 2022 to somewhere around $153 or $155. So those are our premiums, but be aware there's something called IRMA, Income-Related Average Monthly Adjustments. And so you could be paying more for Part B premiums depending on how much income you have. The next income level would be $204 a month in premium instead of $148.50. Can go all the way up to $500. Now, of course, those paying $500 a month are making incomes of $500,000 or more. But in any case, there is a means-tested program that will adjust your Part B and, in fact, your Part D premium, Part D prescription drug as well. But the adjustments are more significant as it relates to Part B. Just for those who are coming from employment situations, if you're still employed, if you have a company with 20 plus employees, then the company plan pays first and Medicare pays second. If your employer is a company of less than 20 employees, then Medicare pays first and the company becomes secondary. So many smaller companies require their employees to sign up for Part B to help supplement the costs of outpatient care. There are some payments of drugs through Part B, typically drugs Part D as in drug. Part B does pay for certain things such as infusion therapy, supplies associated with insulin, etc. But most other things fall under Part D prescription drug, which we're going to be talking about momentarily. Next slide, please. So here it is, Part D, very momentarily. Just to try to give you an introduction to Part D. Again, this gets kind of complex, and yet I've tried to make it as simple as possible. So embrace this as you will. Feel free to get in touch with me. My information will be presented at the end of the presentation for additional information about this. Part D is regulated by the federal government, but provided by private insurance companies. So for Medicare Parts A and B, you sign up through Social Security. For Part D, prescription drug, you're buying a prescription drug plan from one of a number of different insurance, also called pharmacy companies, but it's really insurance companies which then subcontract with the multiple pharmacy chains, CVS, Rite Aid, Walgreens, etc. A lot of those different chains have contracts with the different insurance companies which offer prescription drug plans. Here are a few things you need to be aware of when you're shopping around for prescription drug plans. There are participating pharmacies and non-participating. They may also be called preferred versus standard. So you want to sign up and with a prescription drug plan that will treat your pharmacy as a preferred pharmacy, or else you might consider switching pharmacies. I myself, when I joined a plan, originally I was going to CVS. I chose a plan that had Walgreens as its preferred and CVS as a standard. Well, I chose that drug plan, so I chose to accept Walgreens as my preferred pharmacy. So it's very important if you're choosing a plan, make sure your pharmacy is going to be a preferred pharmacy. There's typically at least 5 to 10 pharmacy chains that are deemed preferred by any of the prescription drug plans. There are 4 phases of a prescription drug plan program. I'll outline those on the next page very briefly. Again, could get a little complex. There are 5 basic tiers and a 6th tier that they've now added to help people pay for insulin. So what we're doing when we're shopping for drug coverage is finding out which drugs that we take are in which tiers. The higher the tier, the more expensive your copays are going to be. So we're shopping around trying to find lower tiers for our drug. And there's a lot of similarities between the plans, but occasionally you'll see a big difference. So for instance, I myself at one point was taking a drug that got placed into tier 3 during the year, which was more significantly expensive than if it had been in tier 2. So when I arrived at the annual enrollment period, which we're all in right now, I looked around to see which of the plans might treat that drug as a tier 2 drug, thereby saving me about $40 a month just for that one drug. Very significant. So beware of the tiers. Beware of the formularies as well. Those are approved list of drugs by the pharmaceutical company. They're not standard. Believe it or not, you would think if it's government regulated, everyone would have to offer the same list, but not so. So again, if you're taking particular drugs, you want to make sure that they are on the formulary so that the drug plan will pay for them, okay? So those are the most important things, I think. Again, creditable, as good as coverage. If you've been working for an employer, and you then leave and join a prescription drug plan, if your drug plan with the employer was creditable, there'll be no penalties. If you're working for a small employer, it was not really a full drug plan, you might end up having to pay penalties. One other thing to keep in mind, these discount cards that that they give out at a lot of the pharmacies are not prescription drug plans authorized by the government. They might be helpful to you at some point. They might give you some discounts, but they're not truly prescription drug plans. There are a number of those plans on the market. You see advertisements about them showing, for instance, someone came in and they were told the drug was going to be $68, but if they join this company that offers discounts, maybe the drug would only be $15 or $25. Well, these discounts are great, but they're not formally a prescription drug plan. It may come back to bite you later on when you really need some significant drugs and you don't have a prescription drug plan. Next page, please. So as I was saying, there are 4 phases. It gets a little complicated, really, but the reason I put this up is because a lot of people have heard about the third, number 3, the coverage gap or donut hole, when a certain amount of money has been spent and you're now in the donut hole. The payment methodology can change. Prior to being in the donut hole, you'll pay by tier. If you have drugs that are in the low tiers, you may never reach the donut hole. That's our hope. Once you get into the donut hole, you or I as a policyholder are responsible for 25% of the cost. The other 75% are borne by the drug manufacturers and the drug plan that you have joined. Important point, there's no credit for drugs bought through a discount plan or from out of the country. You read a lot of articles about people who said, I order my drugs over the internet from Canada or Brazil or wherever, or people who live further north and take bus trips up over the border to buy drugs. But it's not counted in the formula for purposes of getting out of the donut hole. So that's an issue one needs to be aware of. The other important thing that when you're in the catastrophic phase, they're trying to make drugs less expensive to you. The concept being, well, you've spent enough already, except for brand, they will charge you 5% or $8.95, whichever is greater. Hopefully none of you are in this situation, but I certainly run into a number of people where that is the case. So they take very high cost drugs. They may have rare forms of cancer, bone disease, neurologic conditions, etc. There's limited number of drugs that they have access to. They're all brand drugs and they can be $10,000, $20,000 a month. I know Congress is constantly having discussions about this, saying we have to try and protect people. There ought to be an out-of-pocket maximum. So hopefully you don't fall into that category. For those who do, there are state prescription drug assistance programs. Some of the manufacturers have assistance programs. I've heard there are some nonprofit organizations as well. That's when you really have to start scrambling around and do your research. One other important point about Part D, and then I'll move into the supplements, is why should you buy Part D? If you only have relatively insignificant health issues, I'll call that, some basic high blood pressure or high cholesterol medication, so you're only using lower tier drugs, tiers 1 or 2, you might be getting them for $3 or $5 a month at Walmart or Costco, and you're going, well, why do I need to sign up for a prescription drug plan? 2 reasons. Number 1 is the penalty. Over time, as we age, when you finally start needing more expensive drugs, the premiums are going to be going up for the prescription drug plan, and you'll have to pay those for the rest of your life. Secondly, if you enter into a situation where you have an emergency or new conditions should arise, which happens to all of us, that's life, At that point, if you don't have a prescription drug plan, you're facing retail costs of very expensive drugs. And then anything you save by avoiding some relatively low premiums for joining a prescription drug plan will pale in comparison to what you see in terms of the cost of drugs. So that's why I try and encourage people to join a Part D prescription drug plan. And the AEP, Annual Enrollment Period, that we're in is the time to do it and to shop around, see what plan works best for you. Last thing, we have access to something called the Medicare Plan Finder. I run Plan Finder analyses for a lot of people. They show the best deals, and the best deal does not mean just what the premium is, but rather the total out-of-pocket costs. So learn about the Medicare Plan Finder. You can Google up Medicare Plan Finder. You can go to Medicare.gov and find it on there. Then you'd enter the different drugs you take. It will give you a printout which shows here are the least and most cost prescription drug plans for you, and give you detailed breakdowns as well. So that, I think, pretty well does it for Part D. Hope that wasn't too much detail. For those on lower incomes, people should be aware of the Low Income Subsidy Program, that was known as LIS, also known as the Extra Help Program. So these are designed so that if people don't have incomes low enough to qualify for Medicaid, they can still get assistance with their drug copays, deductibles, and coinsurance. So, it's a tremendous help to millions of Americans. Their income and asset limits. You can get more information through the Social Security Administration. And the other quick thing I'll say is there's a complimentary at the bottom of the page Medicare Savings Program, and that's related to the same kind of assistance to people on the medical end. So the Low Income Subsidy Extra Help is related to the prescription drug side of the coin. The Medicare Savings Program relates to premiums, copays, and coinsurance for services offered through Medicare Parts A and B. So if you're in that kind of abyss, so to speak, in terms of the costs of medical services and prescription drugs, you must be aware of these programs that can provide very valuable assistance. So that's a little bit more detail about how it relates to Part D, prescription drug. So we'll move on now to the next slide, which basically shows, okay, so now that you know about D, so we talked about Parts A, B, and D, and now we're going to be getting to Part C, the Medicare Advantage end, and other supplementary programs. So the Part A and B deductibles, we know they're a gap unless you have a supplementary. The 20%, again, could be a big gap if you use a lot of services. The days 21 through 100 in a rehab and skilled nursing facility can be a big gap if you're paying $187.50 a day. It's also something called excess charges by what are called non-participating physicians. Now, actually, these physicians do participate in the Medicare program, but they're, for whatever reason, called non-participating physicians. So be careful about that, because it's happened to me in the past as well. You ask someone at the front desk, do you participate in the Medicare program? I have Medicare coverage. They say yes, but are they fully participating? So if they're participating but not fully participating, they might be called non-participating physicians. In essence, they have a right to charge up to 15% more for their services. could happen in, laboratories, could happen in outpatient centers. So be careful about making sure that based on your coverage, whether this is a fully participating physician or other type of practitioner. So all of those reasons, kind of help contribute to why we would want to have supplementary coverage. There are other things that are considered gaps. You're going to see some of these words reflected in the ads you're seeing about Medicare Advantage plans: dental and dentures, vision and hearing, acupuncture, over-the-counter medications and supplies. So the ads are saying, call us, let us tell you how you can get everything you deserve or all the services that Medicare isn't giving you. That certainly is a part of that discussion. And that's a way that Medicare Advantage plans are appealing to a greater percent of the population. In terms of long-term care, unfortunately, and not well understood by the public, Medicare does not pay for long-term care. So if someone says, well, Medicare pays for, skilled nursing in a nursing facility, the answer is if it's of a skilled nature and up to 100 days, which really isn't that very long in the scheme of things. So long-term care means you need care for an extended period of time. It could be for any number of hundreds or thousands of reasons where we need assistance. It's usually in a personal care mode, assistance with activities of daily living, supervision due to having dementia or Alzheimer's. That is not covered through Medicare, just so you're aware of that. So because of these gaps, we're going to go to the next slide. We're going to see there are a number of ways that you can group your coverage to make sure you try and address these gaps. But one very important thing, because I've run across this quite often, and it should not be forgotten. A lot of times people are listening to these presentations and they're thinking about, do I need to have a Medicare Advantage plan? Do I need to buy, quote, a Medigap policy? And a lot of people around this region have retiree health plans and, or should I say, or they have government plans. They could be county or state or federal employees who've retired, and they need to understand that the coverage they have will probably, depending on the level of the coverage, may well suffice, as opposed to being involved with a Medicare Advantage plan or a Medicare supplement plan or a Part D prescription drug plan. So everyone listening in, if you have some kind of retiree health plan or a government plan, be aware of what you have. There are just an enormous amount of plans out there. Some of them are low option plans, some are standard plans, some are high option plans. The premiums that you pay differ. So it might be a plan that you do not need to subscribe and pay premiums for some of these private plans, the type of plans that I am involved in offering. But you need to know what you have. On the other hand, you may have a retiree plan or a government plan, lower option, and you think, well, I'm covered. Read the print, read the outline of coverage, the summary of benefits, see what percent of different coverages they offer, what kind of gaps are in those plans. Is it a better option possibly to sign up for Medicare and a Medicare Advantage or supplement plan rather than that plan? We don't know. There's no across the board answer to that question. You need to know what you have, but in a lot of cases, be aware you have it, because people hear all this talk, see all these presentations about Medicare and start thinking, do I need it? How does it relate to the kind of coverage I have? The first answer is you need to understand first what coverage you do have. Then you can make a decision whether you need some Medicare coverage, whether you'd rather switch to Medicare, if that'd be a better deal. but make sure you understand what you have and how it relates to what's being offered out here. So that's my appeal to everyone, because I get that quite a bit. People don't understand the type of retiree coverage they have and how it relates to the Medicare program. So with that, I'm going to move on to the different types of supplementary plans in the time remaining. And so let's go on to the next page. And there's a little bit of a small print here trying to get everything on one page. But in a nutshell, a Medicare supplementary plan is also known as Medigap. They're one and the same. Sometimes people have a Medicare supplement. They're asking me, should I also be looking at a Medigap plan? It is one and the same, two different ways of saying the same thing. You're either supplementing what Medicare is offering, or you're filling the gap through buying a Medigap. There are a number of features of these plans that cover what Medicare does not, including the 80%. A lot of these plans also including the days 21 through 100 in a skilled nursing facility. So that could be very important. Again, typically people will look to buy a Medicare supplement when they sign up for Part B, because when you do, you have 6 months of what's called guarantee issue. There is no underwriting. So I could have cancer, I could have, be suffering the after effects of a stroke, 1,000 other conditions. Once I sign up for Part B, of course, A and B, no underwriting. Underwriting means they're going to look at your medical records and say, do we want to accept you or not? In this case, guarantee issue means no underwriting. Otherwise, after 6 months, you can be underwritten. I was making that point about changing coverages as well. If you change from the Medicare Advantage, you go back to what's called original Medicare Part A and B. You can get a Part D prescription drug plan without underwriting, but at that point, you might have to be underwritten for a Medicare supplement. So be careful about that. Now, there are some reasons where you can get a guarantee issue plan for Medicare supplement in addition to the first 6 months. So if you're leaving a Medicare Advantage plan located elsewhere, let's say you've moved to this area from another state or even another county to be close to a family member, and you may be able to get a guarantee issue plan. Perhaps a Medicare Advantage plan no longer being offered, you have the right to select a guarantee issue Medicare supplement plan. That happened a few years back. In the case, use an example, MedStar, the big chain, of course, Washington Hospital Center, big player in the Baltimore, Washington market. They had Medicare Advantage plans for several years. All of a sudden, they decided to pull out of the Medicare Advantage business. They wrote everyone who owned a MedStar plan a letter saying, we're not going to be offering this plan. So you could use that to either sign up for a different Medicare Advantage plan, or if you thought you did want to be protected by Medicare supplement, you had the right to join without underwriting. So that kind of situation can occur. Medicare supplement, main attraction to it, you can go to any Medicare certified practitioner throughout the United States. So if you spend a lot of time of the year in another part of the country, let's say you spend time with a daughter who lives in Kansas City or in Los Angeles or wherever it happens to be, Medicare supplement is a national program. That Medicare supplement coverage applies anywhere, as opposed to with Medicare Advantage. It's very well defined by your geographic service area. Many companies offer Medicare supplement. You see a lot of ads, probably more than any other, from AARP, United Healthcare, and they talk about the freedom of choice. No networks, no referrals. You don't have to go to a primary care physician and say, I have a pain in my side, will you give me a referral to go see a gastroenterologist? None of that referral business. So that's very appealing to people. Again, many companies offer Medicare supplement, AARP, United Healthcare, Aetna, Mutual of Omaha, Cigna, Humana, et cetera, et cetera. So the important thing is which plan you're buying. They're based on letters. So there's really plans A through N at the bottom of the chart, as you'll see. So you have to make sure if you're doing comparative price shopping that you're comparing an AARP plan G to a Aetna plan G, not a plan B comparing to a plan L. So the lettering is the important thing that you need to be familiar with. Depending on the letter, the more complete the coverage may be. So you need to do comparative price shopping. Again, we're in the annual enrollment period, but that doesn't apply to Medicare supplements, otherwise known as Medicaps. This period really applies mostly to Medicare Advantage and prescription drug plans. So one other thing to know, if you feel that Medicare supplement plans are too high in premium, there is what's called a high deductible Medicare supplement plan. I think it's an excellent choice for people, especially as they've aged a bit, because prices do go up by age for Medicare supplements. But the high deductible plan provides a very reasonable premium in exchange for the fact that you understand you're going to have high deductible up front, up towards about $2,400. But which sounds like a lot, and it is, but if you consider that to be the upper limit of what you're going to pay, and given the costs of medical care, that's really not too bad. So that's something I make people aware of. It's also something a lot of the companies are advertising Plan N, which is less, for instance, than a Plan G. The major difference is with a Plan N, you only have a $20 copay for any outpatient visit. If you don't make that many outpatient visits, the $20 won't be that significant. If you make a lot of visits, you add up all those $20, you might be better with the full Plan G, so that you don't have those $20 every time you go to a provider. So that's a little bit of an overview of what Medicare supplement plans are. So then the second choice, as we go to the next page, are called Medicare Advantage plans. And again, of course, we're being bombarded with Medicare Advantage plan information right now. They can be provided by large insurance companies, predominantly companies like Aetna, Cigna, United Healthcare, and Care First. They can be provided by large medical care delivery systems. Johns Hopkins, now unfortunately, Hopkins doesn't offer a plan in Prince George's County, but a second example of a medical provider that is licensed as an insurance company as well, Kaiser Health Plans. And there are certainly a lot of Kaiser participants in the area. They've kind of transitioned from having Kaiser before they retired, for instance, or turned 65, to a Kaiser Health Plan Medicare Advantage plan, kind of a seamless transition. So in Medicare Advantage plans, you're signing over your Part A and B. You still have to have coverage through Part A and B, and that means you have to pay the Part B premium as well. You cannot escape that by joining a Medicare Advantage plan. The Medicare Advantage plans will not accept you unless you have A and B coverage. You're going to turn your A and B coverage over to the plan. They're going to become your provider. They are, of course, going to bill Medicare anytime there's a Part A or B service rendered, so that the government, in effect, will be paying the Medicare Advantage plan. And then in addition, you'll be paying for some of the copays, which is the challenge in making a decision about Medicare Advantage plans. Important, concept is you must be part of the network, or rather your provider must be part of the network. So you went to Dr. Jones, you join the plan, the Medicare Advantage plan, you find out Dr. Jones is not part of the Advantage plan. Well, that, you have to make that determination before you join up for the plan. Each plan has different networks of providers. So you want to ask your provider if you're very, close to them in terms of, wanting to continue to go to that provider. Do you participate in any of these plans? If they're in any of these networks, that would more likely be a reason you would want to join the Medicare Advantage plan. But you can't go to that provider and say, well, Part B will pay he or she 80%, I'll just pay the 20%. Part B will pay nothing because Part B is now in effect owned for that person, for you, the policyholder, by that Medicare Advantage plan, if this makes sense to you. There are regular, chronic needs, special needs plans, and dual eligible plans. That for lower income individuals on Medicaid, the dual eligible plans can be extremely beneficial because in addition to having all your Medicare and Medicaid benefits, the companies will offer a lot more of what are called value added features, such as they'll give you, dental coverage, say for up to $1,500 to $2,000. They'll give you vouchers to go to a pharmacy, typically in the range of $50 a month, to be able to buy over-the-counter supplies and equipment, etc. So if you are a dual eligible Medicare and Medicaid recipient, you might want to be aware of a dual eligible plan as well. So again, the major issues of Medicare Advantage plans, you must, pretty much stay in your network, and there are going to be a number of out-of-pocket copays until you hit a particular maximum. And each plan, as you're shopping around, may have a little bit different cost sharing for particular services you use and particular out-of-pocket maximums. So that's the challenge during this period of shopping around, looking at the different Advantage plans, seeing which may be most beneficial to you cost-wise, and then of course also see which networks of doctors and hospitals they have, because those are the ones you're going to be using. So we'll go on to the next slide. We're coming to the end here. A couple more features just to be aware of. I'll go through this quickly. Again, I hope everyone will have access to these slides, and of course you'll have access, as you'll see at the end, to myself if you'd like to call and get some additional information, no obligation. Prices are consistent regardless of age, which is a very good feature. It is an advantage of a Medicare Advantage plan because Medigap plans are priced by age. So as we age, they can become pretty pricey. Prices of a Medicare Advantage plan are the same regardless of age. Whether you're 65 or 95, you choose a Medicare Advantage plan, the premium is set. So, that's a very good thing. Plans differ by jurisdiction. The plans available differ by county, by state. And so that's one of the challenges. You see advertisements and it makes it sound like, oh, I like that plan, but it may not even be available in your particular jurisdiction. So that's something you need to research on or consult with an agent such as myself. Again, there's no underwriting for Medicare Advantage plans. So you may say, well, I really like the features of a Med Sup plan in terms of freedom of choice, and no copays for all these different things, but I have XYZ condition, a situation, you're not going to get underwritten, you'll basically have to then join a Medicare Advantage plan. That will be your choice. But that's very good. It's available to the, pretty much the entire population, including those with end-stage renal disease. They were added on as of January 2021 as being able to have no underwriting and get access to Medicare Advantage plans. We talked about the other issues of the in-network versus not in-network. There are some programs called PPOs rather than HMOs. PPOs will allow you to go out and use some other physicians, but at a higher price. So if we're all trying to economize, we're most likely looking for a good HMO to keep our expenses consistent. As I mentioned, there are value-added services both for the regular plans and, of course, for the dual eligible plans. One thing I would caution, be sure you know what all these extras are, because, again, the advertisements make it sound like you're going to get everything. Sometimes the advertisements are only talking about the extra value-added benefits if you're dual eligible. So if you're not dual eligible, it's not going to be that same amount of value added. Second thing is they make it sound like, wow, you're going to have dental insurance, like, wow, I can finally get my whole mouth fixed, so to speak, by joining a Medicare Advantage plans. The basic plans only really provide some preventative dental. Some of them do offer, for an additional fee, some additional dental coverage, but it's not going to be, thousands and tens of thousands of dental coverage at no price to you. You would still probably need to buy a freestanding dental plan, which a person can do on their own. So we'll go to the next slide and finish up. So at this point, for 2022, during annual enrollment here, the choices available to Prince George's County residents. There's a new company called Alderwood. A lot of the people who were associated with the University of Maryland plan, which was now bought out by CareFirst, splintered off and created what's called the Alderwood plan. So there's two of those. CareFirst has two choices of Medicare Advantage plans. Cigna as a preferred HMO. Kaiser has three choices of plans. United Healthcare now, this is new in these suburban Maryland residencies. United Healthcare is now offering an Advantage choice, two different types of plans there, which is, I think, good news, should be well received. And as I say, CareFirst, which was previously University of Maryland, offers a dual prime as well. That's the one dual eligible plan available for 2022 in Prince George's County. So each of these, you have to look at within the observation you'll make about deductibles for drug plans. What are the level of copay requirements, which have lower or higher out-of-pocket maximums? What kind of networks they're offering, because each of the hospitals, for instance, may be associated with different plans, but not with all of the plans. So if you have a particular interest in being able to use a particular hospital, you want to make sure that hospital is in the network. So just finishing up now. We can go on, please, to the next slide. There is something called the Medicare Savings Account. It's a little more difficult. Just want to make you aware that anyone who would like more information, I'll be happy to send you some of the literature. It's an interesting hybrid between a Medicare supplement and a Medicare Advantage plan. It has some of the features of each of them. There is no premium. It's a zero premium. And Medicare, believe it or not, actually deposits some money into an account. And then we have a certain level of copays, just like in a Medicare Advantage plan. And when you hit the max, you're 100% protected. So it's a growing new approach to the Medicare coverage industry, and a very interesting one, I think. Not many people are aware of Medicare savings accounts at this point, but they are available for those who find this to be an interesting approach to covering your Medicare supplementary needs. Please feel free to get a hold of me, or it's on Medicare.gov. They actually have a separate section called Medicare Savings Accounts with a lot of information. So that's pretty much the situation in terms of all of the Medicare choices for 2022. If we can just finish up with the next few slides and we will wrap up here. So this is kind of a summary of should you join an MA plan versus not. Again, we're talking about price. If you join this, you won't have to pay for the premiums on a Medigap plus a Part D, but there are a number of co-pays. Be aware about that. Be aware of all they're offering. Read your outlines of coverage. Make sure you're aware of any other type of protection you have through a retiree health plan. Don't join if you're concerned about the network restrictions and need for referrals. And again, be aware of the out-of-pocket copays, because you could pay a low premium and get some preventative dental and a few other throw-ins, but be aware of that list of copays, because when and if you need them, that's when they'll become very real to you. So people need to use their insurance, it's great. But when you get into the details and you then need to start paying for certain things, that's when you start realizing. So everyone, do your homework during this period. Be aware of what you have and don't have for when you need it, which hopefully won't be for a long time to come. So wrapping up then, I will just tell you that some of the other sources of information are the Medicare New Handbook. Anyone who's already enrolled in Medicare gets that annually. Big thick book of about 150 pages. Very overwhelming, but useful information. Medicare.gov on the internet is certainly far and away the most well-recognized source of information. It's also SSA.gov. Of course, SSA is where you're signing up for Parts A and B. For those federal employees, there's even OPM.gov. Plenty of information out there. There's my name, email address, and phone number. No fees, no obligations. I try to, enlighten as many people as I can, make them aware of all the products, which, by the way, I do offer all these products at no cost to the consumer. Agents such as myself are only paid once someone places an application as approved by any particular company. The prices are the same for the products as well. So I'm always happy to provide advice, input, send literature, etc. Feel free to reach out to me if you'd like. I hope you found this informative, and happy AEP shopping to all. Thanks very much for your time and attention.